Still breaking out after your teenage years are long behind you? You are not alone. Hormonal acne can flare up anytime in adulthood, but is particularly common in perimenopause and menopause. So today I'm gonna break down why that happens and how you make it go away. I'm Dr. Sam Ellis, and I'm a board-certified dermatologist in Northern California, and I'm here to help you understand your skin and find products that work for you. So if that sounds good, make sure you're subscribed to the channel and you give this video a thumbs up. Before we delve into adult acne a little bit more, I do have to get this off my chest, which is the term hormonal acne. In the video, I'm gonna be using it to refer to adult onset acne because that's how it's generally used out in the community. But the reality is most acne is hormonal. It's the entire reason why you don't break out when you're a little kid and you start breaking out as you start going through puberty. It's those new hormones and those surges of hormones that prompt the acne to come to the surface. But for today, I'll be using the term hormonal acne to specifically refer to that adult onset acne because I think that's the term most people are familiar with. So why does hormonal acne happen as you start to approach menopause? And for many women, this is going to be in their late 30s or early 40s. And the main reason is because our estrogen levels begin to drop. And I kind of think of estrogen as protective against acne. We have all sorts of androgens, so sex hormones that go through our body, namely estrogen and testosterone. And there's always a balance between them. And as our estrogen goes down, the relative testosterone rises, and testosterone drives the acne process forward. That loss in estrogen also leads to our skin barrier weakening, which means we're going to be more prone to things like irritation and inflammation. Also, we can't discount the life stressors that tend to pile up during this time in our lives. A lot of times people are taking care of kids, they may be taking care of aging parents, they have a lot of life responsibilities, and that increased stress absolutely can take a toll on your skin and make you break out more. And your lifestyle is also going to play a role. How you sleep, what's your diet look like, what other medications or supplements are you taking? Certain B vitamins can make you break out, certain antidepressants can make you break out. So we need to be factoring all of that in. And although hormonal acne can happen anywhere on your face, it can happen on your chest and on your back, most commonly hormonal acne is going to be on the lower face and the jawline. It may just be a few pimples from time to time, and it might be cyclical where it comes up like right before your period, for example, or it might be chronic lower facial breakouts. And I always want to stress you are not alone in this. Sometimes my patients come in and they're like, why am I the only one in my friend group breaking out? But it's estimated that about 25% of women in their 40s and about 15% of women in their 50s and beyond get hormonal acne. And your friends might not be breaking out because they're treating it. So what are they doing to treat their acne that you're not? Typically, as a dermatologist, I like to start out with topical treatments because if we can get this under control with a cream or two, maybe a lifestyle intervention, and we don't have to go to systemic medication, that's great. My number one topical recommendation for any type of acne, including this hormonal acne, is a topical retinoid. Retinoids are a category of ingredients. They're all derived from vitamin A, things like retinol, retinaldehyde, adapalene, tretinoin, tazarotene. Those are all retinoids. And some are definitely better for acne than others, which I'll get to in a second, but they work because they help regulate cell turnover, they help unclog your pores, and they're anti-inflammatory. Not to mention they have anti-aging benefits, so talk about two birds, one stone. The topical retinoid with the most evidence both for treating acne and for anti-aging benefits is prescription tretinoin cream. Oftentimes you can get this prescribed by your primary care doctor, your dermatologist will be happy to prescribe it. Using this every night can really help reduce breakouts. The hardest thing about incorporating a retinoid into your skincare routine is that it can cause some irritation, especially initially as your skin is adapting. So I always recommend that you start using it just a few nights a week and then you slowly work your way up to nightly. And then while you're using it, you don't want to just forget about the rest of your skincare. You want to be supporting your skin with hydrating products, with good moisturizers, so that your skin can really tolerate that retinoid as many days per week as possible. Aside from tretinoin, other retinoids I really like are tazarotene, can be a little more irritating for some people, but quite effective, as well as adapalene, which you can get over the counter. For example, the brand Differin makes the 0.1% adapalene that I recommend all the time to my acne patients. And you may have picked up on here that I did not recommend retinol or retinaldehyde, even though I love those ingredients for their anti-aging benefits and the fact that they're very gentle with skin. They're not well studied when it comes to the treatment of acne specifically. So if you are breaking out, we are going to stick with things like adapalene, tretinoin, and tazarotene. And I really want you to prioritize getting that retinoid into your routine. I would not bother with other acne topicals, which have the potential to also be irritating, until you've optimized your retinoid usage. stage. Now, if you're still breaking out, or if you're one of those people who cannot tolerate retinoids, because that happens from time to time, then there are other options for you. I really like azelaic acid. This is antimicrobial, it's anti-inflammatory, it helps with pigmentation. It's kind of like a jack of all trades when it comes to clearing your skin. So it can be a nice add-on to your retinoid routine, or you can use it on its own. Azelaic acid comes in a prescription strength, but you can also get it at lower concentrations at the drugstore or at Sephora. I love the one that Paula's Choice makes. Another topical acne ingredient that I like, and we recommend this for all types of acne, is benzoyl peroxide, which you can find in a leave-on form, but I tend to like it in a wash or cleanser. The main reason it works is because it kills acne-causing bacteria. When you don't have that bacteria on your face, it's a lot harder to get a breakout. I'll link some of my favorite benzoyl peroxide products in the description box, but I really like the creamy acne wash from Panoxyl. CeraVe also makes a great one. Just be careful because it can bleach your towels or linens, so either pick towels that you don't really care about or make sure you are meticulous when you rinse it off. And I do want to give a little mention to salicylic acid here. Salicylic acid is not my holy grail when it comes to treating acne, but it has some good anti-inflammatory effects and it can help unclog your pores. So if your skin can tolerate it, incorporating a salicylic acid wash into your routine, which is especially good if you can't tolerate benzoyl peroxide, can be really helpful. With Prequel, we made a 1% salicylic acid cleanser, so it's a really gentle cleanser with salicylic acid for the people out there who have sensitive skin but might also be dealing with some texture that they want to calm down. Now, if someone is in the office and they're already getting a prescription for topical tretinoin to treat their acne, something we're often also talking about is topical antibiotics, something like clindamycin, which can be applied once a day to help calm down those inflammatory pimples. And I know sometimes people hear the word antibiotic and they're like, no, but when you use it in a topical form, it has no side effects. It tends to be very, very well tolerated, and it can be a really great supplement to topical tretinoin or other acne treatments that you may be using. But let's talk about some other things that we might recommend in the office. And I'm telling you this because sometimes it's helpful to hear it before you go in and talk with your dermatologist, so you kind of have a once-over. The world of dermatology and dermatology prescriptions can be so overwhelming. And if you go into your first consultation for acne and you're getting all these names and options thrown at you, it can be really hard to make a decision or know what's right for you. So think of this as like priming you, a little pre-education, so you can start to get an idea of what you might like best or what might work best for you. So I know I mentioned topical antibiotics, but oral antibiotics also do have a role in treating adult acne. Now, it's never something I want my patients to be on for a long period of time, but if you're an adult and you're having a huge acne flare and you want to calm it down quickly, oral antibiotics are usually the fastest way to do that. And when I'm prescribing oral antibiotics, the goal is that that's not the only acne treatment that you're doing. Sometimes we use it as a bridge. So while your tretinoin is ramping up, while your topical antibiotics are kicking in, you have that oral antibiotic working in the background, calming things down faster. And this is particularly important if I'm worried that that acne is going to cause permanent scarring. We need to shut that inflammation down fast. So for most adults, and this actually applies to teenagers who are taking oral antibiotics for acne as well, the goal is really to have you on those antibiotics for fewer than 3 months. We are using it to shut things down, to get other treatments started, and then we don't want you on them anymore. Now, much more commonly than using oral antibiotics in my practice, for my adult patients with acne, I am recommending an oral medication called spironolactone. Spironolactone is actually a blood pressure medication. It works as a diuretic, so it makes you pee out a little extra fluid, but it also helps block hormone excess in the skin. It essentially prevents testosterone from binding to the oil glands in your skin and stimulating breakouts. And for a lot of people, it works very well. The word miracle is not thrown around a lot in a dermatology office, but over the years, I've had countless women tell me that spironolactone has been an acne miracle for them. And the reason I like spironolactone so much is not only is it super effective for people, it tends to be well tolerated and it's very safe for long-term use. We have great clinical data saying that spironolactone can be used for decades without issue. If you're interested in learning more about spironolactone, I have an entire YouTube video dedicated to it. We go over the side effects, who's the best candidate, if there's any screening that's required. So I definitely recommend that you check that out if you're interested in trying it. Now, if someone comes to me and they're like, listen, I have tried all the topicals, I've tried spironolactone, I've been on antibiotics, I am still breaking out, it's causing scarring, it's causing emotional stress for me, that's when we start having a conversation about isotretinoin, also known as Accutane. Accutane by far is the most powerful medication we have for treating acne and getting a more permanent result with resolving it. That being said, Accutane does nothing to address the hormonal component of acne. So if you're an adult woman and you're still getting tons of breakouts, we may try Accutane to calm your acne down overall, but you can still get some breakouts even when you come off of Accutane. It's not a cure in that case. And deciding whether or not Accutane is the right medication for you is a really personal choice. It should involve a conversation with your dermatologist. It's something I use in my clinical practice all the time for the right patient, and it can be transformative for someone's life. Now, let's say you're doing some of these topical treatments, maybe you're taking some of these oral medications, but still like once a month you get a big pimple that just won't go away, or you're worried that it's going to cause scarring because it keeps coming up again and again and again. That's where an in-office steroid injection can be super helpful. We use a very, very low dose of triamcinolone, which is a steroid, and we inject it directly into the pimple, and usually within 24 hours, it flattens it out. Now, that's not something I would recommend doing every single month, but if you have a huge event coming up and you get a big pimple on your forehead or on your chin, getting an in-office steroid injection can be incredible. Now, from time to time, I will get a patient who has tried the topicals, tried the oral medications, maybe spironolactone didn't work for them, maybe they're not a good candidate for Accutane, or they don't want to take it. And I used to say, sorry, I don't have any more options for you, but we actually now have a laser that can treat acne. This is very cool technology. It has not been around for very long, but it's incredibly promising. There are two main brands of laser that exist right now: Avaclear and Acure, and they both use a 1726 nanometer laser, so that's the wavelength of light that that laser emits, to specifically target the sebaceous glands or the oil glands in your skin. Every laser out there works by targeting something in your skin, whether it's hemoglobin, so blood, melanin, pigment, water, but now we have one that targets the oil gland and it helps cure acne. Now, unfortunately, these laser treatments are never covered by insurance, and you usually need 3 to 4 treatments, usually spaced about 1 month apart, but the results are really incredible. Typically, you have to wait about 6 months to see your final result, but I've had many patients clear their acne with this device. If you want more information on this type of laser, just let me know in the comments and we can chat about it. And the final thing I want to give a shout out to is hormone replacement therapy, or menopause hormone therapy. A lot of women, as they go through menopause, they're not just experiencing acne, they have hot flashes, they're noticing changes in their skin, in their mood, and that's where using hormone replacement therapy can be very helpful. Now, I'm a dermatologist, I don't prescribe this, but it is a conversation that comes up with my patients, and I always encourage patients to explore it if they're having a lot of symptoms from their menopause transition. It's not something I would recommend just to treat your acne, but if you have breakouts and you have other things going on as well, why not be more comprehensive about it and get to the root cause, which is this big hormonal shift that is happening at this point in your life? Have you suffered from hormonal acne as an adult? Let us know in the comments what worked, and also let us know what didn't work. Thank you so much for being here. Don't forget to give this video a thumbs up and subscribe to the channel, and I'll catch you next time.